name is Emily, and I decided to research specific phobia, the epidemiology, etiology, and treatment. If an individual's fears or responses are out of proportion to the actual threat posed by a stimulus, then the person is considered to have specific phobia. Also, it's important to know that specific phobias are heterogeneous with respect to sex and age. Significant rates of comorbidity are associated with the disorder, and many different factors play a role in the etiology. Behavioral treatments are the most effective because symptoms of specific phobia are easy to identify, and studies are continually increasing our understanding of even more effective treatments. The objectives of my paper are to describe the course and criteria of specific phobia, to realize epidemiology, including prevalence and comorbidity, to explain etiology, including psychological and biological factors, and to show support for the most effective treatments. Haugen and Whitmore define specific phobia as an irrational and unabating fear of a particular object, activity, or situation that provokes an immediate anxiety response, causes significant disruption in functioning, and results in avoidance behavior. Some of the DSM-IV criteria for specific phobia include: the person recognizes the fear is excessive or unreasonable, the phobic stimulus is avoided or else is endured with intense anxiety or distress, and the distress from the phobia interferes significantly with the person's functioning. There are also 5 different types of specific phobia, including animal, environmental, situational, blood injection injury, and other, which include phobias that don't fit cleanly into the other 4, and it's important to specify these when making a diagnosis. Epidemiological studies show that specific phobia is more prevalent in women than in men. It's the most common mental disorder for women and has lifetime prevalence rates doubling those of men. In addition, one study determined that the point prevalence rate for women was 26.5%, and for men it was 12.4%. Becker et al. Discovered that most specific phobias start early in life, usually around 8, except that situational type usually starts much later. Most cases of specific phobia do involve comorbidity with other Axis I or Axis II disorders. For example, specific phobia and depression are highly comorbid, with specific phobia usually preceding depression. And this relationship is even more pronounced with individuals who have more than one phobia. Also, another study found that 1/3 of adolescents who suffer from specific phobia also have depressive or somatoform disorders. The causes or etiology of specific phobia are also very important in understanding the full courses of the disorder. The causes of specific phobia are multifaceted, including a history of negative learning experiences. These can be from direct experiences, observing others who have negative experiences, or from being informed about danger through hearing or reading something. Psychological factors also definitely play a role. Some individuals pay more attention to threatening information. Some tend to hold beliefs in such a way as to maintain or increase their anxiety, and avoidance behaviors can also maintain a person's fears because they prevent individuals from learning that the objects they fear are not as threatening as they feel. Biological factors can also play a role in etiology. Some biological perspectives include that we are programmed to fear anything that can threaten our survival, and studies show that the disorder can be genetic as well. Studies have also been done on the role of brain structures on specific phobia. Michelgaard et al. Found that fear provocation can result in permanent changes in the amygdala in the brain, and Roch et al. Found that individuals with specific phobia have increased cortical thickness. In addition, another study on protective factors showed that positive mental health and life satisfaction predict greater chances of remission. As for treatment, few studies have shown that medical treatments are very effective. For example, treatment differences between escitalopram, a drug used for depression, and a placebo were not significant enough to show that the drug was an effective treatment. On the other hand, behavioral therapy treatment has shown to be the most effective, with techniques such as imagery, flooding, and systematic desensitization. Exposure treatment have shown to be the most effective. One study showed that 3 different types of exposure therapy, including active imaginal alone, and graduated in vivo exposure, were all effective and showed no difference between groups, showing that many different types of exposure treatment can work. And And in another study, a one-session treatment of exposure resulted in 55% of participants no longer meeting diagnostic criteria, which are much higher than the other two groups in the study. In conclusion, specific phobia is a highly prevalent disorder that causes significant distress and impairment. Epidemiology and etiology are important to understanding the full course of the disorder as well as effective treatments. Behavioral therapy treatments are much more effective than medication. However, much more research should be done to better understand the causes of the disorder as well as to find even more effective treatments.